Morning, everybody. Really appreciate the time for all of us to dig into what we started to tackle when I did get a chance to meet everybody in West Virginia. So really excited about continuing our discussion right now. And Jenny, I know that you're loading up the slides. What we're going to go ahead and do today, and Jenny, and we have about 15 minutes, correct? We have a full hour. Is that right?
Yes. Yep.
Okay, great. So I know that we've chomped into a little bit of the time this morning, but we're going to go ahead and get started and jump into the PowerPoint right now. And I think Jenny's loading that. Very good. Can everybody see that on the screen? So we're going to go ahead and get started and talk a little bit about the toolkit, which we had a chance to introduce quickly when we were in West Virginia, and making some time to kind of really look through some of the general themes and what was going on in terms of the real elements, so that we can talk a little bit about how that applies to the work. And I think that while we go through this, we'll have plenty of time at the end to move this ahead. And so I'm actually presenting solo today, Katie Bocci, as well as Nicole Hardy and Holly Wolf. I'm going to talk a little specifically about some of their work and interests in the toolkit, and then actually talk a little bit about how some of the applicability of case studies and constitutions come from different people, different organizations in different states, to give everybody an idea of what's inside and how representative the tool really is. So what I wanted to say, next slide, Jenny, is that right now the toolkit itself is actually a product of the National Colorectal Roundtable and the University of Colorado Cancer Center. And right now, the toolkit, as many of you have seen the hard copy version, I believe Mary Ellen or Jenny might have sent out the PDF format. It is an actual complete guide that has active links, and we'll talk a little bit about how the tool itself functions. But essentially right now, you can print it out, you can use the formatted PDF, as well as actionable links to be able to move around within the toolkit, because as we're going to talk about a bit about, the chapters and the content really speak to each other all throughout, in that all of the sustainability and paying for navigation themes are really interconnected. So one of the things I also just want to mention is we do have an evaluation component within the toolkit. There is a specific place where when you download, you can give some thoughts around your experience, input around what you'd like to see, what worked, what didn't work, and I'd really like some time from all of you to hear a little bit about how the tool is working for you. In addition, there are some policy components that, because the roundtable is supported from CDC directly for this initiative, we've actually created a microsite that helps house some of the information. And we're going to even show in case the work that Katie Bocci and others had mentioned when they were talking about the Kentucky experience. Some of that lives within that microsite, and that's an ancillary the tool for the toolkit in terms of giving people some additional insight about policy and some of the other issues. So we're excited about all of the pieces and parts that really make this toolkit come together. Next slide. In terms of looking at the toolkit guides and the people who've really been involved in putting together the pieces, again, Dr. Holly Wolf is an advisor on the project, and we're going to talk a little bit about what the roundtable brings in terms of her perspective. She recently retired, and she's one of the people who has been very engaged in a lot of the policy work. Hear a little bit about Katie and her perspective, and then Nicole Hardy, who's a student who graduated recently, who's been working with me, has really helped bring together the proponent and the work around return on investment, and really talking about making the business case for sustainability. So, these are a couple of the folks who've been very engaged in helping pull this together. But as I note in one of the final slides, it's almost 100 people who've been really actively engaged in bringing the toolkit together. So that gives you an idea of the breadth and depth of information involved. Next slide. So before we go and get started, I want to talk a little bit about why we developed this and what it does. But I also need to really just be really clear about what this toolkit will not do. So in terms of right now, in terms of the state of patient navigation and reimbursement as it relates to preventative services and screening for cancer care and the like, there's that one time, at this time, there's not one direct way to pay for it. there's actually a lot of different mechanisms that have to come into play that really help support paying for navigation. But right now, there's not one fee-for-service code, billing code, HCPUF, Medicare, Medicaid. All of the groups have not come with one unified strategy. So what the toolkit aims to do is talk a little bit about, in a lot of the different settings, how can you really look at paying for it and sustaining the effort. I think I made the point that when I was in West Virginia, that you can even start with dollars and support the work, but if you don't have a champion, if you might not have someone who's really helping build the business case, if you're not really thinking about from a policy perspective how this is going to be implemented within your setting, even if you have dollars to support the work, it doesn't mean it's going to stay there. And so one of the things that we're really going to talk a little bit about is what are the different means by which people are supporting navigation, sustaining the work. And for those who are even at the very, very beginning, how would you even start this work if you have yet to implement much in the area of patient navigation and sustaining the work? So the toolkit is really about the example, as I noted before, with about 100 different folks who contributed to talk really about their accomplishments, their struggles, as well as what are their real-world examples and evidence that help bring forth the real notion that navigation for preventative screening is really showing improvement in health outcomes and then ultimately showing the cost savings, cost neutrality, or even showing improvement outcomes and using that data to suggest that and how do you make that work for you. That's really what this toolkit is about. And so American Cancer Society, the National Colorectal Roundtable, and the CDC have really put this together and helped us move this forward in terms of our thinking. One of the things I do want to say, though, is what this toolkit will not do is it will not talk about how to implement navigation from the 101 in terms of specific skills for navigators. It won't necessarily particularly give you one straight from 0 to 60 how to pay for it, and that here's one billing code. This is really about how do you really help build the program, how does it work in a variety of settings with a variety of different people who can work, how do you use the data, how do you think about what makes the business case for you, because not the case for sustainability and what sustainability means from one center to the next might look very different. That's what this toolkit is about. But what I do want to say is that if you're interested in basic training for navigation, really thinking about supervisor's role, manager role, as basic skills, implementation up to even the more deliberate how to deliver navigation interventions. There's a variety of programs throughout the country that do that, and that's Harold Freeman's program on the East Coast, the Patient Navigator Training Collaborative in Colorado, and I know Washington State or others have a number of curriculums in addition to what GW Cancer Center has done, as well as even groups like the coalition in South Carolina and in the Carolinas who've done a lot of great work in terms of building navigation programs, and as well as my program in Colorado, the colorectal screening program. So I just want to remind everybody that that's what this toolkit is really about, and that's what we're really going to delve into. Okay, next slide. So when we talk about sustainability for patient navigation, we're really talking about a lot of different things that have to culminate, as I mentioned. And really, if you look at that center star, that's really what we're thinking of as strategic planning, which is sort of the core center around making something sustainable. But as you see all these icons, it really takes a lot of the work, and we're going to touch on how these specific chapters really speak to these areas and elements of sustainability. But we're talking about funding, political support, partnerships, building capacity and organizational capacity, really talking about the public health impact, communication strategies, evaluating, and really thinking about how you adapt the programs as well. And so really when you look at the literature, when people say for something to be truly sustainable, you have to have all of these things working together. So if you only have part or half of it, most of the time you're really not looking at a full sustainability strategy. So this is something for us to really keep in mind as we're getting ready to delve into this work. Next slide. So when I look at the chapters and how the toolkit is developed, when we really think about the nexus again of being around sustainability, and we'll delve into each of these chapters in a little more detail, what we wanted to do was create something that you could really pop in at any point based on what your specific strategy is, whatever you wanted to accomplish, or the like, that it really was a place that you didn't necessarily have to read front cover to cover, Each chapter is dedicated to telling you a snippet of what the information is about, the objectives, what is the need to know, and if you want to dive in, then it gives you a chance to go further. But it also says, like, hey, if this is not where you want to be, that you turn to chapter 6 and it's about economic analysis and making the business case, but it's really clear that you haven't really done, put together some of the evaluation strategy or the metrics in place. You can then easily hop to chapter 8 to kind of learn a little bit about what do you really need to be evaluating so that you can have the kind of data to help with an economic analysis or giving some quality outcomes. So each one of these chapters are, again, independent. They can use, but there's also ways within the toolkit to jump from place to place so you can see how it really builds upon, an idea that sustainability works. And when we think about that, we're really talking about the first chapter talks about that sustainability framework and what are the real movers and shakers in that sustainability case. Chapter 2 will give evidence base for colorectal cancer screening navigation. So ultimately, who are the priority populations? How do we know that it works? What are the role and skills of a colorectal cancer screening patient navigation and a navigator? And who would we really think about in terms of serving from a health equity standpoint? And, we bring this forward because a lot of the evidence base is still very much needed to make the case in a business setting to managers, in grants, even sometimes with legislators. We have to go back to what are the real pieces that we're talking about. Chapter 3 gives some real-world examples of New York, Colorado, South Carolina, New Hampshire, Alaska, and then even within our microsite, we give further examples of groups like Kentucky who've done a sensational job in the area of policy to give them a little bit of a real-world examples of who's doing what in terms of implementation of navigation, how do they make it work, what they think people need to know, what are some of their pitfalls, and what are some of the great opportunities they have as well. And we use this sort of structure so that it really gives entree into jumping into the rest of the toolkit to show exactly how people made this work. And when you really think about the drivers, again, with that sustainability piece in play, we're talking, again, about that big dollar sign, the payment approaches. So we're really thinking about where do you start? So soft and grant dollars, foundational dollars, and then how can you really look at more direct means for paying? And some right now, in terms of our Medicaid, some of the codes that are open in certain states might give more of a direct line for reimbursement. That's not universal, and a lot of times those codes aren't open for everyone to utilize, but that's something that could be happening. There are things around Affordable Care Act, accountable care, also looking at some of the specific means for quality, which we get into Chapter 5 and the like, that there's reimbursement, and you can really look at that payment approach. But this one really gives you an idea of, like, where can you start if you have that sustainable or if you have that support to pilot money to get you going. How can you really help them thinking about, with the rest of the chapter, really building it in so that it's a streamlined or institutional support. And so jumping into Chapter 5 and 6, those quality accreditation standards, so UDS measures. A lot of times, if you show the business case for why a navigator works, and you're seeing increase in your screening or UDS measures, a lot of times the decision makers will say this is a good investment, and we'll use some of the institutional support that we have to utilize these people. A lot of times when you're looking at how do you, within certain health systems, achieve certain quality outcomes and measures, in a variety of settings, whether it's patient-centered medical home, an ACO type model, something around achieving a UDS measure or the like. There's a lot of weight put behind these pieces, and sometimes the navigators can really play a central role in that if you make that case. And so Chapter 5 goes into detail about how to do that, and we'll talk about that in more depth. And then Chapter 6 talks about the economic analysis. And part of what really holds strong here is ultimately saying, if you have these dollars and you've shown the support or others have done this work, use this data to show really how you can make that business case. So Chapter 5 talks about the quality. Chapter 4 talked about the payment approaches. Use the outcome data to show really how you can do cost analysis, how you can give a perspective on what's already been done, how you can measure certain costs and the like to show improvement within your health system or to the general population to make the business case. And one of the big sort of lessons in this chapter is a lot of this work has already been done. you don't necessarily always have to recreate the wheel. You can use examples of what people have already put forth in the literature as business case and use that in proposals a lot of times. But if you do want to do a cost analysis or review this sort of work, we also go into greater detail about how to do that, what you want to measure, and then who to include in these strategies. And Chapter 7 then gives some specific description around policy. And when we talk about policy, we're talking about big P and we're talking about little p. And when we talk about big P, we're talking about the kind of policy that Katie spoke of when she was in West Virginia about how do you really work with your lobbyists, with the gentleman who accompanied her for the presentation. Those are folks who made policy move in a big way around navigation, preventative care, screening, as well as the care coordination element. And so there's a lot of great work that's been done in a lot of different states to help drive at that level. But that usually takes the work of a coalition, multiple organizations and entities, and this toolkit gives them specific and explicit information about who to pull in for this sort of work and how to make that happen. But even in a smaller, like microcosm sort of sense, we also then talk about what are some of the office policies that are really needing to work well within a system to make patient navigation and navigators really a mainstay within the clinical setting. And sometimes it's as easy as even having job descriptions, making sure people are aware of what is the role and scope of the navigator in relation to the rest of the care team. So this Chapter 7 really delves into that kind of big P, little p policy type measure to get just a pulse on what do you need to be thinking about within your state. And then I would say that what I think is probably one of the most important pieces is if you really think about how do you do any of this work from Chapters 1 through 7, you have to evaluate and you have to know what you're measuring. You have to know what your end goal is, and you have to know how you're making the case in terms of specific measures, variables, data collection, instrument tools, and that you're really putting that ahead in the game in terms of thinking about how do you measure the metrics and piece to put all of this into play. And so Chapter 8 really goes into the evaluation pieces. And so when you really think about how all of this works from Chapters 1 to Chapter 8, these are all of the things that you can either start here at any one of these central sites and build upon that work, or you can really start to focus on one area and build that out. But what you'll find is that most of the time, just like when we saw that center core where all the sustainability pieces working together, you have to have most of that in play to have something truly sustainable and continue to pay. So again, you can start with some of the payment strategies, but it doesn't mean that if you don't have some of these supporting pillars to move it ahead, that you're going to make it work. And again, Chapter 3 really talks about that with the different states who have done this and who are doing this well, but still have some room to make some progress as well. And then, as noted, Chapter 9 really talks about the other supplemental resources. One of the great resources that I want to mention is that we have specific training programs, but Lynn Butterly and her team from Vermont and New Hampshire have actually put together a fantastic implementation guide as well. And so we've actually talked a little bit about how these two toolkits really implement some of the fantastic strategies in terms of thinking about what do you do to implement navigation, and this one thinks about how do you really help support and sustain. And so I really just want to remind you all that this is really helps part of the puzzle, but if you really want to think of the larger context, that's some of the information I presented when I was in West Virginia about the who, what, how. But this is really how to keep it going from a business sense, from a sustainability sense, from a measurement sense, and that's what we're really talking about here. Next slide. So the way that the toolkit works is within each of the samples, you can read more about it in terms of some of the specific published materials, find it online. You can stop and do reflect. There's specific customized tools, easy to adapt tools that are included in the toolkit, as well as see it in action, so some specific case studies that I talked about, and that specifically with some of the groups like the states. Frequently asked questions. We know that there's some very specific things that are going to come up for people time and time again in terms of look like they could be, showstoppers, or they could be some of the things that people really cue on in terms of their thinking. We've tried to include those as well. And then as noted, the redirect. And so one of the things that, as I mentioned, is if you delve into one of the chapters and you really think to yourself, like, hey, this sounds very much like, in the evaluation toolkit or in the evaluation chapter, I saw something that really spoke to how Colorado was doing or how South Carolina was doing or New York was doing something. I've tried to make sure that when you're in specific spots of the toolkit, you can go from one area to the other to kind of really see how these messages and how these specific chapters come together, live together, so that it really can show the ultimate ideal, like I started about talking, is really showing that general sustainability, how it all works. And so that's really kind of how this is laid out, so that each one of the areas complement each other, speak to each other, and can kind of give you the breadth and depth of how to help really sustain. Next slide. So as I mentioned at the beginning, and this is something that I like to say, is that it's kind of like the choose your own adventure that you probably had when you were 8 years old. If you picked up that copy of a book like that or something like that and you started in one place, you can really jump in at chapter 7, chapter 5, read it from front to back. What the ideal is that you really pick where you are and what's of most interest to you, because the rest of the chapter, the rest of the actual toolkit itself will unfold for you. But really, there's no wrong way to eat a Tootsie Pop of sort. It's just jump in where you want, figure it out. But I would just encourage you all that there's something for everyone here, whether it's, again, needing to understand even what accreditation measures fit, what work you're doing at the federal level or at the policy level within your own state or within your own organization, or even if you just haven't quite understood what measures to evaluate for return on investment, or to even implement your program to show quality measures. As simple or as complex, there's something for everyone. And if you start, I think you'll really feel that you really like any choose your own adventure. You start in one place, but you ultimately end up in a place that helps inform your thinking, figure out where you're going or where you need to go next. And these are, or maybe just reinforcement of a lot of the work that you're doing. So this, again, is just a reminder that there's a lot in there, but there's a lot of really good concrete ideas and concepts, and those can build upon each other, but you can even start as simplistic as possible. Next slide. So when we really think about, the specific chapters, and I've given some really broad context to start, but really when we think about digging in, I want to just give you guys just a little more of a flavor of what's actually inside. Before, we really can get going, a lot of times is that we have to talk, and there's been a lot of discussion about what is quality navigation, and that isn't just an enrollment specialist. It isn't just someone who's doing, an initial call. It isn't someone who just hands out, an element of the ballot preparation without the education. Chapter 2 gives us specific examples of what is the evidence cited in terms of what does it mean, what does it do, what does it mean to navigate, and what does it work, and what are those outcomes. But it actually shows some very specific case studies, sustainability studies, as well as what's working for people in terms of the sustainability themes and evidence, and what is the definition of a colorectal cancer navigation and navigator. And there's some very specific examples of why patient navigation for colorectal cancer is needed for screening, why the navigation and how we know it works, how the titles work together, and what does it all mean in thinking of paying for screening navigation. And this also gives some very specific examples of what other states are doing in terms of defining the role, giving job duty and description, and that's part of what we covered in West Virginia as well. But it's really important that we make sure that we understand the evidence and that we can articulate that and use that, again, in a variety of settings to make the case. Next slide. Chapter 3, this gives you just kind of a little bit of a flavor. What we try to do in each one of these chapters is give that background of what is it that each of the states, tribes, or cities have done. And so South Carolina is our example here. So what you'll notice is in each one of these chapters, we have setting, detailed approach of how people implemented navigation or screening navigation, the question and answer about lessons learned, and then ultimately each one of these states has some specific examples that they've done very well in the area of sustainability that you can build upon as well. So what you'll notice here is we try to keep it simplistic and complete, but give some really good food for thought. Next slide. But in addition, what we've done is then give some very, very good detail about the settings, the population they focus, how they deliver navigation, what are the characteristics of the navigators, and how do they start and sustain funding, and then what does their work look like to date. And so again, each one of these states gives that real good overview, gives the question and answer, but you also get a little bit of an idea of what they've done to implement the work in their setting. And part of the reason that I bring this up is that South Carolina and some of the other states and different groups might have a statewide approach, but I think it's important to remember that, not all clinics, not all settings are included in some of these really large statewide programs. And so even if you're in West Virginia or if you're in Colorado or if you're in the like, and you're even thinking about sustainability of navigation and you're not one of the participating groups, there's still something in here that gives really good insight about what you should be thinking about for implementation and sustaining the work. Even if you are part of the state model or outside of one, there's something for everyone in terms of what each one of these states have provided in terms of insight. And so this just gives you a flavor of what's in Chapter 3 and how to make that work for you. Some very broad, some really good qualitative, descriptive, as well as some very concrete, like how-to type examples. Next slide. This is, again, the Colorado experience. And one of the things that I wanted to mention is that in terms of our work here in Colorado is that we've tried to give some examples, and you'll see those icons that we really have a lot of work going together. So, for instance, if you look at Tool 2.1, given the colorectal cancer screening navigators are delivering navigation in a variety of settings, and that the division of navigator services can vary incredibly, it's important to understand who is delivering the different components of the navigation, ensure that they're a keeper of the process. And so what you'll notice here is there's this descriptive icon that when you hit that, you'll go to a specific tool that outlays exactly what's happening. But what you also see here is that in Colorado, that we've really done a lot of work around patient-centered medical home status, and that ultimately to help make the sustainability case, PCMH is a big part of what we drive within our clinic systems, because a lot of clinic systems have been able to achieve level 3 status by implementing navigation within their clinic system. So you'll notice there that, even within Chapter 3, you have a chance to go back to 2.1 to see a tool, and then even Chapter 5 to see how PCMH accreditation really works for us here. So this gives an idea of just how it works and how it can work for you. Next slide. Holly Wolf, and this again jumps a bit as well, talks a little bit about our work in Colorado, and that ultimately talks about the toolkit really can help you think from that big P, little p opportunities for implementation. But one of the things that I want to just note is that the National Colorectal Roundtable is really, the policy section is really doing a lot of advancement around navigation and thinking about policy indicators and how do we continue to drive this work. So I think that's something that we'll continue to see ACS working towards. And Holly talks a little bit about in Colorado, our work with the policy perspective has been a lot about making sure that we have a statewide alliance that provides good uniform definition of what we mean around care coordination for colorectal cancer screening navigation. And regardless of what people call themselves, we're talking about this as a process that our Medicaid offices, that HCCUS, that a lot of the work we're doing even in clinical settings should be a policy measure. And in Chapter 7, we go into what I mentioned, long-term financing and workforce development to highlight the most essential organizational elements, as well as provide specific cases to policy, like Katie's work to show what does and doesn't work within different states and what are those lessons learned. So what I would say is even in Colorado, although we've had some of these very concrete and awesome tools that I just mentioned, a lot of the drivers around policy are what's going to help sustain this work. And Katie talked about that. All the states talk about that on some level. But one of the important things to do and remember is that NCCRP is help driving this. But also within your state, there's a lot of different organizations and groups that have provided insight about how to, and it's really helpful to bind and join together, I think as Katie noted, within these policy initiatives. So a statewide cancer coalition, a statewide alliance of navigation or community health workers. Chapter 7 goes into some of the very specific ideals and gives people an idea of what are some of the groups that have started to culminate in the state and nation to help drive policy ahead, and how you can really learn from their work, engage in their work, and what to do to help move your policy and drivers ahead. Next slide. So what are the real opportunities to pay for navigation? And one of the mentions at the head is that most of the time, it's not normal that people will just start having an institution that will start paying for the navigators directly out of an operational budget. Most of the time, patients have to show proof of principle, or patient navigators have to show proof of principle that this truly does work. And a lot of times that can help with really thinking about soft funding. So American Cancer Society, Prevent Cancer Foundation, local West Virginia grants, local grants within maybe even some of your foundations. It's really, really important that you're really thinking about how are you going to navigate, how are you going to fund those navigators, who are the interested parties, and how can you start moving that ahead. But it's also very, very important for you to think about from the beginning in Chapter 8, evaluating. How are you going to evaluate? And in Chapter 6, if you're going to look at making a business case, what do you need to be thinking about ahead of time while you're getting these dollars to show that proof of principle? Who are the champions? Who are the people you're trying to make the business case? So if you get dollars and you get this support, I would encourage everyone to also be thinking about what is your long-term goal and objective, and how are you going to parlay even some of that information about your outcomes into making a bigger business case or sustainability case for navigators. And so, as I noted, there's some very specific strategies, and what's noted in the toolkit are grant opportunities, how you can utilize Medicaid, Medicare, some of those open coding that can be utilized within team-based care, and the like what's open with ACA right now. And so some of those opportunities are definitely listed, but what I would encourage all of you to do is also really think within your state and your community, who else would be also some good champions for helping fund the navigation and the screening navigation element. Next slide. So in terms of the quality and the accreditation piece that I mentioned before, what we tried to do in Chapter 5 is do a really nice job of outlining what do we mean by accreditation and what do we mean by some of these specific measures. And by and large, what we're talking about in this chapter is that if there are specific clinical groups, organizational type accreditation or quality groups, we're really trying to draw those out and say, what are those specific opportunities that if you include care coordination for improved outcomes, where you will be able to meet a quality or an accreditation measure. So if you look at what are the current accreditation measures, we tried to look at this from an organizational community standpoint, hospital setting, clinical setting, as well as a bevy of other types of centers, and said these are very specific accreditations that if you have navigation included and you can show improvement in reduction of barriers and access to care for preventative screening, you can really help make the business case for navigation. And so what we've gone through is for every type of study, whether it's a cancer center, a hospital, an FQHC, a rural health center, and even sometimes community organizations, to say, you all have great benchmarks that have already been put forth. How can you really show that navigation is helping you meet those and then ultimately help sustain that work? And then again, as you can tell and mentioned, you can even ultimately think about what are those quality indicators from evaluation, how are you making that business case, how can you show what others have done to complement your work to help drive this piece. So we really tried to make sure that we talked a little bit about how can you utilize this information, but also really think specifically, Jenny, if you can go to the next slide, what are those very specific accreditation measures? So for instance, what you'll see here on Chapter 5 is under 5.2, 5.3, 5.4, we've actually been trying to bring out what are those very specific CMS measures, how do you meet that measure, and if you think patient caregiver experience and the like, preventative health and the like, if you look at those types of indicators, those are satisfaction measures, and we know that patient navigators improve satisfaction. So all the different types of studying that I mentioned, we really tried to pull out and say, if you look at these specific standards and these descriptions in these specific areas, you might even be able to call out that this is where navigation has made an impact, and again, help build that business case. So Chapter 5 is really trying to show the big picture as well as bring it home about how do you make that work for you. Next slide. And then again, as noted with the economic analysis, one of the things that we want to do here is just give everybody a real glimpse of what do we mean by making a business case. And what I would say about this chapter is this. A lot of us really need to know who we're trying to convince that navigation makes sense. And if you're trying to talk to a CEO of a hospital as opposed to a policy or legislative person, those are different audiences. So one of the things that we've really tried to ask is that really thinking about from evaluators to program advocates to managers to decision makers, the questions that you might be asking yourself and providing information to them might be different based on your audience. Know your audience. And then again, as mentioned, there's a lot of work that's already been done Chapter 6 really tries to give some good idea of where you can already go to show that the work has been done in a very pristine way, a lot of times for showing business case, return on investment. What I would say is that with an ROI or business case, don't do it unless you have to. There's a lot of work that's already been done. Delve into chapters like this and work like this and show proof of principles based on what others have. But if you need to do these sort of analysis yourself, the big pieces, don't go it alone. Really critically think about who you can partner with, how do you make it work, and the like. For anyone who joined the evaluation discussion with ACS and the roundtable about a week or two ago, one of the biggest things that Heather from South Carolina mentioned is School of Public Health, sometimes state comp cancer and coalitions can really help you think about this work. So don't do the heavy lift around an economic analysis unless you have the expertise inside to do that kind of work, because it's a lot of work and it can be complex. But the big thing here in that we're talking about is making the business case is Chapter 6 gives some really good evidence of what's already been done in the field, and so you can help use and parlay that information into your own and for your own case particularly. Next slide. And one of the things I want to mention is Katie touched upon some fantastic things when she was in West Virginia, and really in terms of thinking about the microsite, which is listed here as well as within the Toolkit internal, is really that Katie talks a lot about the value of the Toolkit, people working at various stages in the work. So I talked about from the beginning, if you haven't started thinking about the sustainability case that you need to, just hop into the introduction, take a look. Think about the work that you're doing. There's small wins even to start, and as you grow that work, you can do that. Katie provided some personal opinion about the biggest contributions to the Toolkit. And if you look at that Toolkit microsite, she actually talks a little bit about the role of really coalition building, and that you can't really drive navigation within your state ahead without working together. And so if you check out that Weebly connection and that microsite, she gives some very specific tools about how do their alliances start to work within their state, how do they work with policy initiatives, what kind of apps did they already start working together to build on what they've done in Kentucky. We've tried to give as many really, really fantastic, good examples of the work that others have done to help drive this piece. And you'll notice within this toolkit, as well as the microsite that really combines, that there's a lot of fantastic already experiential tools and work and case studies that are being built upon. So if you really look at that, Katie's take-home message has always been, there's nothing in here that even if you're brand new to thinking about sustainability, that's over your head. You can start anywhere. You can start and read about it. You can email. You can ask questions to me, any of our team at any time. But in addition, there's also a lot of really great work that's already been done. Use those tools and really make it your own. Next slide. And then because I'm a total nerd, Chapter 8 is totally my favorite piece. And as you noticed, a lot of the work really drives and builds onto the evaluation that we have to think about. And then if I really think about what are the things that we have to really measure for evaluation to make sustainability work, we have to look at the no-show rate. We have to look at valve preparation quality, successful exam completion, satisfaction with navigation, and timeliness of care. These are the big indicators that are making our business case, and that if we show that we have good outcomes, we've implemented navigation in a means that we can show fantastic outcomes for these variables, we're ultimately going to do great things in terms of making the business case and sustainability case. So if you really take a step back and you think about Chapter 1, most of this data is key to substantiate that what you're finding within your setting is very consistent with the evidence. Number 2 is to contribute to the evidence base as well, is that as people are really having great examples and good experiences, with navigation, a lot of the work in the literature to build on evidence comes from measurement of these pieces. You have to show outcomes if you're going to sustain. If you're trying to make the ultimate key, and that's what each one of these people talked about in Chapter 3, is that they had to use data to make the case. Make data work for you, but you have to evaluate early on to show what kind of outcomes you're making. And you have to monitor the data for grants and proposals and to build that case. So again, if you start with soft funding and you want to make that a more mainstay and make the business case in Chapter 6, you have to show your decision makers that this, even with the pilot funds, it makes good sense to sustain that even from your operating funds that's available. In looking at Chapter 5, data is really the key element for all of the quality and accreditation measures. If you don't have the data, you can't really meet those measures, and you can't report upon them. In Chapter 7 is it ultimately looking at the organizational and legislative rely on data to make their case as well. So again, you could see that this is really fundamental. So if I had to say, if there's one place that people really need to probably stop, back up, and think, it's really what are you doing for evaluation strategies, how are you reporting, and what kind of tools do you have to make this work. Chapter 8 goes into that kind of detail. And so it really also builds on other types of tools as well. Next slide. And ultimately, this toolkit, again, is just to really think of a number of people who are working in a variety of settings. Think about what are they, where are they with ultimately thinking about the payment, whether it's grant support, foundational support, or you are institutionally operating with the navigator. How will you sustain this work? Because nothing is a gimme unless you, again, have all of those elements really in play. And then ultimately, I just want to remind everybody that this is a great insight about how to help really pay for and sustain the work, but there's a lot of fantastic work that's already being done in terms of how do you manage and supervise navigators, how do you really think about implementation of navigation programs in terms of skill-based learning. This toolkit will not do this, but this is a toolkit that you should be thinking about utilizing while you're getting programs underway to think about how you're ultimately going to sustain. And Chapter 9 gives some fantastic examples of work that Tracy Battaglia, others have done in the breast cancer realm, Lynn Butterleaf's work for the implementation, as well as groups like Dr. Freeman and the PNTC who do fantastic jobs in terms of training people around what are the core navigation elements and how to really help deliver navigation within different settings. So this gives everybody really kind of again, a flavor of what are the things you need to be thinking about for sustainability, how can this tool help, with a variety of examples of what's happening within the field to make all of this happen. So Jenny, I think we have about 10 more minutes now if we want to open up the line or if there's any specific questions that have come forward.
Does anybody have a question or comment? Going once, going twice? Last call. All right. We want to thank you, Andi, for giving up your time to do this for us. We really appreciate all the information you've given us. And if there's no other questions, I guess we'll end a few minutes early then today.
All right. Everybody, I would just encourage you to go to the NCCRT site to download the tool, to think about the work. I know, Jenny, we're going to get a chance to meet with more of the folks in West Virginia in August. And then if there's any specific questions or examples from West Virginia that we wanted to unpack, I'd be happy to work with all of you, again, in a different setting if there's some specific questions that come up based on this piece. But find it important because we ran out of time to really delve in. So Jenny and Mary Ellen and team, if there's anything else that you need, just let me know.
All right. Thank you very much.